Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes with Valley Health. You know, addiction is considered a highly treatable condition and recovery is attainable. Valley Health can help you or your loved one get there. So we're talking with Brett Wellman, the Chief Community Health Officer at Valley Health, about that today. We're so glad you're here to tell us what options there are out there.
Well, thanks for having me.
Yeah, it's great information. So many families are affected by this. What treatment options are there available at Valley Health?
So Valley Health offers a variety of services for different types of addiction, whether that's what we see in traditional substance use disorders such as opioid dependence, methamphetamine or stimulant use disorder, as well as alcohol dependence. We also have some services available, depending on the scenario or the situation, for other types of disorders that are maybe not related to medication use or drug use, such as gambling addiction, video game addiction. So we have some therapists that specialize in other types of addiction services.
It's interesting to know that Valley Health can address a variety of conditions, not just substance abuse, because people can be addicted to so many things. Food, as you said, video games, gambling. Let's back it up though and talk about medicated assisted treatment. That is for substance abuse. What does that entail and how does that work?
Yeah, that's the kind of the mainstream therapy and treatment in an outpatient setting. We see a variety of different types of medicine, what are known as agonist or agonist-antagonist, and then antagonist medications. And so those act differently within the system, within the body. When you take those medications, they're targeted particularly on opiate receptors when we talk about opioid dependence and those types of medicines to help manage or mitigate symptoms. Or to prevent some of the effects that may happen if you take an illicit substance or an opiate, to help the person in recovery be able to manage every day and feel comfortable every day and feel well and do well on their recovery journey. We also see medications that we use primarily for alcohol dependence, and those work to help to curb some of the triggers, cravings, desires for alcohol use when we're working with alcohol dependence patients.
And how do the medications work? Are they a pill? Are they a shot? Do you have to go into the office?
Yep, there's several different forms, particularly when we talk again about opioid dependence. There are injectable forms that are once every 4 weeks. There are injectable forms that are weekly. And then there are oral medications that come in the form of a pill or a sublingual film that the person will place under their tongue every day or sometimes a couple times a day.
So a variety of ways to get the medicine.
Mm-hmm.
That's good because not everybody is okay with shots, so it's good to have some options. Talk to me about the behavioral health and what an important part that is to the recovery journey.
Yeah, absolutely. And within our medication-assisted treatment program, therapy is a mainstay of the program, whether that's through group therapy, also individual therapy that's provided, where that's one-on-one, the therapist and the patient, working on a treatment plan, working on progress, trigger control, craving reduction, managing everyday symptoms. It's part of what the program really is all about. So I would call it the backbone of the therapy program. We also have what's called peer recovery coaches. So those are persons who've experienced addiction and are now in long-term stable recovery. And they're very active in the program to help patients along the journey and be able to really build a comprehensive recovery program.
A lot of support as people go through this
Absolutely,
process.
yes.
Talk to me quickly about instant access. What does that mean? Because sometimes people feel like I'm going to have to wait a long time for an appointment.
Yes, it's truly point of care in the moment. Whether you're in a Valley Health office, maybe a remote location, or you're in any of our community healthcare partners' offices and you're suffering from symptoms of addiction or withdrawal and you need care and management, we can generally get you in the moment, as quick as you can get there. So with instant access, we provide same-day services. We certainly get the person in, help them, give them the information about the services. We do a full health workup, and then patients can be treated with medication, or a decision can be made with the patient on what the best course of treatment is, whether that's medication or maybe therapy only. We do provide a track where it's independent of medication, where the individual may be in a position that they only want therapy services, and we offer that as well. And we can do those same day and in many cases within the same hour.
That's impressive. When
Yeah.
you're ready to take that first step, it's great to know that help is ready when you're
Absolutely.
ready. All right, Brett, thank you so much for being here.
Yeah.
Thanks for checking in with Monday Health Minutes.